Right, this is a demonstration on the use of intermittent compression for the decreasing of edema. The equipment that we'll be using for this modality includes obviously the intermittent compression unit, which is found up in the cupboard on the bottom shelf. Stockinette, which is found in the island, a pair of scissors, a blood pressure cuff, and stethoscope. We need a tape measure, and a patient. So I think we have everything. First thing we'll do is verify the absence of contraindications for this modality and inquire about previous treatment and check their chart. The second thing that we'll do, which is a little unique to this modality, is we're going to take the patient's blood pressure. So, put this on. Just a reminder that when you're doing this, that the artery arrow needs to line up with their brachial artery. So the easiest way to find this is have them to do a bicep curl. And when you find the bicep tendon, come medial to that, and you can feel the brachial pulse. And that's where your arrow should line up. So it's going to probably be more medial than what you're used to. She's 110 over 85. So we want to document that number because that becomes important on how we set the parameters on the unit. The next thing that we'll want to do is take measurements, pre-treatment measurements of the area that we'll be treating. So let's just say we want to reduce edema at the ankle. So one measurement that we could do would be a figure 8 where we come right across both malleoli. Base of the fifth, and up around the navicular, and that's at 52 centimeters. So that's our pre-treatment measurement, and we make sure that we document that as well. The next thing that we want to do is protect the area, so we're going to cover it with some stockinette, and you always need more than what it probably looks like for length. Place the stockinette on the limb to be treated. And we want to make sure that there's no wrinkles in this. So, of course, we have their sock off. If we have a closed unit, we need to make sure that we don't have any wrinkles here that would bother her at the foot. So we're going to bring this up a little bit. All right, that looks good. Next thing was we choose the appropriately sized compression cuff, and we'll put that on. And we attach the sleeve to the compression pump, which is right here. Ideally, we would want to elevate this limb as well. The idea is to reduce edema, so compression with elevation would be the most effective. All right, next thing we're going to do is we're going to set our parameter on the compression pump. The reason that we took the blood pressure is because we needed to find out her diastolic pressure, and our intermittent compression pressure cannot go above our patient's diastolic pressure. So, for this unit, it's all on a dial. It's not digital like the new ones are. But we'll go ahead and turn it on. And you can see this dial, and that tells us how much pressure. And we can increase it with this knob. Okay, as we start to see the dial come up, it tells us how much pressure we have accumulating in the cuff. We'll go up just below her diastolic. So the machine is designed, it should come on and stay on for 90 seconds and then drop off, and it deflates for 30 seconds. During the 30 seconds that it's deflating, we want the patient to wiggle their foot, their toes around, try to encourage some circulation. After the total treatment time, we shut the machine off. Check the treated area, make sure we don't have any pressure points or sores we've developed during the treatment. Then we take another measurement again, and we just use the exact same one that we used for the pre-treatment. So across both malleoli, base of the fifth, across the navicular and up. And now she's at 51 centimeters, so we document that and note that there is a 1 centimeter loss of edema with the use of intermittent compression. Before the patient leaves, we have to wrap it with an ACE bandage. So we wrap with an ACE bandage from distal to proximal. If we forget to do that, then it's likely that the lymph will just flow back down because of gravity. So it makes our treatment much more effective if we keep a compression wrap on it afterwards. We'll instruct the patient with any exercises they've been prescribed, clean up the treatment area, and put all the equipment away.